From what I've been reading and researching and what you've put out, $600 million in taxpayer money is pretty much slated to go towards the overcrowding problem with our prison system here. Where are we getting those figures from, and how accurate are they?
Well, it's the prison population forecast, which has been accurate by 1 or 2% over the last 20 years. And the problem is that we actually have a great prison system. But we have usually reserved it for the most dangerous people. And over the years, since 2000, we've had a dramatic increase in our prison population, largely because we're incarcerating more nonviolent offenders and gradually extending the sentence of those offenders. So the question is, how can we manage that prison population, keep the public safe, and find some alternative ways to sanction nonviolent offenders?
Well, you've asked the question, so what's the answer?
Well, we have a lot of good evidence from around the country on how to do that. We know a lot more about what it takes to keep people safe and about sanctions now than we did 40 years ago. Just like we know a lot more about emergency medicine now than we did 40 years ago. If I went and practiced medicine today, like I did 20, 30 years ago, I'd get sued for medical malpractice. So we need to look at the best evidence, and there's a bundle of evidence that was looked at by the Public Safety Commission. They've made a set of recommendations on how we can actually keep the public safe and maintain our prison population without that big growth and that commitment of funds. That's not the only set of dishes on the table. There are other ideas. So we've got very robust conversations going on between legislators of both parties in both chambers, and I'm very confident we'll find a way that maintains the public safety, which is paramount, but also gives us the ability to keep people from committing crimes in the first place. There's two ways to keep the public safe. You can lock people up after the fact, after people have been victimized, and we certainly need to do that. We also can't underfund the ability at the community level for proven crime prevention measures which keep people from offending in the first place.
Okay, we're talking about taking care of the problem on the front end rather than the back end, but that's still going to cost money. So how much money do you want to slate into these prevention programs and education, and what's the likelihood of their success?
Well, the likelihood of their success is very high. They're based on good empirical evidence and best practices from around the country. We've slated about $45 million in this budget to go into proven local crime prevention and community corrections measures, drug courts, drug and alcohol treatment. I've got a huge increase in community mental health investments in this budget. So we're not talking about doing one at the expense of the other, but we are saying that if we continue on our current trajectory and continue to incarcerate low-level offenders, we're not talking about letting out violent offenders, sex offenders, anybody who's a threat to the public. On that path, gradually we are unable to invest in the front end. And I'll give you an analogy. Okay. If you have the choice between investing in prenatal care to keep women from having a low birth weight infant, or investing in resuscitating a tiny birth weight infant in the neonatal intensive care unit, the emotional and political imperative always drives the money into the hospital. And we pull it out of prenatal care so you produce more low birth weight infants. So essentially what we're trying to do is say, okay, we got to be able to lock people up. We have to be able to make sure we have capacity for violent people who are really a threat to the community. But at the same time, we've got to make a front-end investment to make sure people stop offending in the first place. To me, that's the long-term solution to public safety, is actually on the prevention end. So we're basically trying to avoid that huge $600 million potential cost in hard bids by looking at how we sanction nonviolent offenders in order to reinvest dollars in primary prevention.
Well, playing devil's advocate, let's say we invest this money on the front end, and let's say these programs don't work, and we continue to increase the inmate population and crime continues to grow. Are we not then demanding more taxpayer dollars in the long run from people?
We're demanding more taxpayers' dollars right now on our current trajectory. We've got $600 million projected expenditures to lock up nonviolent, low-level offenders. That's money that's going to come out of schools, it's going to come out of health care, it's going to come out of investments in economic development. The programs we're funding actually have a track record. Just like we know how to keep a woman healthy, we know how to invest in making sure you have a healthy infant. We know how to prepare kids to go to kindergarten. These are very proven practices. We're just not funding them. So we have to find a way to bend the curve, to essentially reevaluate our system based on new evidence and new best practices. And at the end of the day, although I think this has been highly politicized, this is not an ideological issue. It's not about a ballot measure. It's about how you keep people safe and how you spend the tax dollars we have in the most effective and efficient way.
Well, some people argue that our numbers are wrong, that it's not going to be an increase of 2,000 inmates in those beds over 10 years. It's going to be an increase more around 800 people in those beds. Would that not be a misappropriation of our taxpayer dollars then, if we're socking that much money into a problem that essentially is only going to increase a little bit, if those numbers are correct?
Well, there's the if those numbers are correct, but also those are dollars that we're going to basically take out of prevention. So it's a zero-sum game in terms of the resources that we have. I would argue that if we invest in these early prevention programs and our prison population grows faster than that, we can make an adjustment. We don't have to lock ourselves in for 20 years. But simply ignoring the overwhelming burden of evidence about alternative ways to sanction nonviolent offenders other than a hard prison bed, and to simply not fund community corrections, not fund investments that keep people from committing crimes in the first place, seems to me utterly irresponsible.
Measure 11 is something you've also kind of talked about, wanting to revamp this, sentencing options, giving more leadway to the judicial system and the judges themselves. However, do you honestly think that assault 2, robbery 2, and sex abuse 1 are crimes to be treated less lightly? I've
actually never adopted a policy of seeking to amend Measure 11. That's one of the recommendations in the recommendations. I have been very clear that I think we need a second look within Measure 7 for juvenile offenders to give them some reason for, altering their behavior. If you lock someone up at 16 before they go into the adult system, having a second look at their sentence based on how they've been doing for 3 or 4 years makes eminent sense to me. That is not one of the issues that's on the table here. And again, I'm not approaching this in an ideologic standpoint or trying to change this ballot measure or that ballot measure. I'm simply asking the question, how do we take the resources we have and ensure that we keep the public safe by having a healthy and effective prison system, but also not starving investments in the front end that can keep people from committing crimes in the first place and keep people from not getting victimized in the first place.
Would you support changing Measure 11 in any way?
That's one of the issues on the table, and it's not really whether I would support it. It really is part of a mix that we're going to have to work out with members of the legislature. And I think everyone recognizes, including the district attorneys who have a significant role in this, that we do have a problem. We can argue about the magnitude of the problem. We can argue about the remedy for the problem. And I'm very confident that by the time this legislature adjourns, hopefully before the end of June, we'll have worked out a way to address that this issue that satisfies all those affected parties.
So our cost per inmate is another thing that some people would rather us look at as opposed to just these preventative measures. When we're talking nationwide, Oregon actually spends a lot more comparatively on the cost per day per inmate. Are you looking at, and are the people on your committee seriously considering cutting back how much it costs an inmate per day to house them?
Well, they're not mutually exclusive. I mean, that's a legitimate issue, but looking at the cost per day doesn't by itself solve the larger problem. My recommendations for adjustment of the public employees retirement system would have a significant impact on the cost per day if they were to be adopted. This is also an issue of collective bargaining, and we address this through the collective bargaining process. But I would argue that were the legislature to adopt my recommended budget, the changes that I had recommended on the cost of living adjustments would have a significant impact on the cost per day.
How big of a problem do you think the inmate growth population is at this time?
I think it's a significant problem. It's no more a problem than the growing cost of health care. But if you look at what's happening in Oregon's general fund over the last 10 years, we're spending more and more on corrections, on the human consequences of abuse and neglect and addiction, and on health care, and less on children and families and education. And that's not a sustainable trend. Investing in children and families and education gives people a path to educational success, gives them a job, dramatically reduces the likelihood that they'll ever be in the criminal justice system. If we don't start spending on the front end, we're going to end up with a state where we continue to spend much more keeping a person locked up than we do putting a child through the university system. It's not, I don't think anybody thinks that makes sense. So we have to sort of put the pin back in the emotionalism here and just ask ourselves some questions. This isn't an either-or proposition. We have to have a strong prison system. We have a good prison system, but it's got to evolve, and our practices have to evolve with the knowledge we have about how to manage the public safety and prevent crime in the first place.
Well, as you're saying, it has to evolve. What are the major issues with our prison system right now that you think need to evolve and or need to change?
Well, the main problem is that we have traditionally used our prison system like we would use the ER. The ER is the most expensive care option in the healthcare system, and it needs to be reserved for people who really need emergency care. Prison is the most expensive treatment option in our public safety system, and it needs to be reserved for people who really do need to be locked up. Since 2000, we have gradually increased our net wider and wider and are capturing more nonviolent offenders and putting them in prison, a hard bed, and gradually increasing the length of those sentences. That's the only piece of this I'm suggesting we need to reevaluate. Not how we deal with violent offenders, not how we deal with sex offenders, not how we deal with people who are truly a threat to the community. And the Public Safety Commission essentially looked at data, best evidence, best practices around the country, and have some recommendations based on that. So I think it's important to understand that we're looking at simply going back, trying to move our prison system back to where it was prior to 2000 and the type of people we actually incarcerate.
You've talked a lot about programs and things along those lines. Can you give us any specifics of the programs that you're talking about on the front end that would help combat the problem of the growing inmate problem?
Well, you know, electronic monitoring is one way you can monitor people. Having more resources for drug and alcohol abuse in the community. There's no question that drug courts are a significant course to sanction offenders, going to a mandated drug court in drug treatment program as opposed to necessarily incarceration. So there's a whole host of alternatives that just simply need to be looked at, and I think the Joint Committee on Public Safety is doing a good job sifting through those. And at the end of the day, again, I predict that we will find a way to do this that keeps the public safe, but also ensures that we reduce long-term corrections costs and improve the likelihood that Oregonians actually get an education and a path to a job.
What if we don't?
Well, I would say that we would continue our current course, which is essentially an implicit policy that says it makes more sense in Oregon to spend money on corrections and health care and social services and underfund our system of public education. And I defy you to take a poll and find very many Oregonians who would say that makes a lot of sense. So I think the thing that people need to look at is if we don't do anything, we're essentially accepting the status quo, which I think most people find unacceptable. So I'm confident that this will be effective, and again, it'll be a balance. I mean, it's going to be a package that respects the need to incarcerate those who need to be incarcerated, but also looks to provide other kinds of sanctions for people who are much lower risk to the community.
And we're still looking at $45 million that you're looking on the front end to be able to do that, as compared to $600 million. Still a lot of money, though. What would you say to Oregon taxpayers about how much money it costs that we're having to even put into corrections, as opposed to other things like education and just other needs that we have?
Well, I would say that if you want good return on the taxpayer dollars, you spend it on prevention. It costs a tiny amount of money on a child to make sure they're ready for kindergarten. It costs thousands. You know, the ratio is huge. It's probably 7 to 1 in terms of early childhood investments versus putting people in prison. It's like managing someone's blood pressure in the community versus letting them have a stroke and taking care of them in a hospital. So I think we're on a very prudent, fiscally conservative pathway to prevent crime and also make sure we can appropriately respond to the consequences of crime.
Anything else you'd like to say to the people of Oregon about this topic?
Well, we'll get this done and you'll be proud of us.
Fair enough. That's all I needed. Thank you so much.
Yeah, you're welcome.